Come on in. Welcome to hang. Stand up a bit. I've been at WVU for 16 years as a faculty member. It's kind of crazy to think about that, and I hope to be here another 16 years. You'll have a sense of why I'm going to stay, and probably through some of my enthusiasm today and through some of the stories I'm telling throughout the presentation. I'm here to take you through a walk in the West Virginia hills today. So let's take a look at where we're headed. All right, so start off some good West Virginia stories. I was very excited to see that Cindy brought some pepperoni rolls because it ties in nicely with my talk. You know, I have two generations, both parts of my tree from West Virginia. One family was a farming family down in Richwood, West Virginia. Now, Richwood is deep in the bowels of West Virginia. You go down to Summersville and you take a left turn that you didn't think you should take, and you go about an hour and some seriously crooked road, you end up in Richwood. That's where my mom's family's from, farmers down there. And my dad's family immigrated from Italy, southern Italy, like many people up in the kind of Fairmont, Clarksburg, Morgantown area, and went to work in the Monongah mines right outside of Fairmont. So I got some good pieces of West Virginia on both sides, although my life plan did not include staying in West Virginia for my work. I'd kind of thought after college and graduate school I was going to go become maybe a surf instructor in California, and it's true, you laugh now, but life has a funny way of teaching you which way to go, and I've kind of just followed that, and it's ended up me back here, and this is where I'm at. So I got a lot of good West Virginia roots, and I'm very excited to be talking to you. You ever have those moments in your life where you kind of don't know how you got to that particular point? You're like, how did I end up here? And sometimes that's a really good thing, and then sometimes it's not a really good thing. Okay, so I'm having one of those really good ones here where I'm thinking, well, how did a boy from Elkins, West Virginia, I'm from Elkins, small town, end up talking in Ritz-Carlton in Naples, Florida to a bunch of people probably smarter than him. So I'm not really sure, but I'm happy to be here with you this afternoon, and I'm excited to share the moment. I'm going to talk about some more additional data on physical activity and inactivity and health to build on what Dr. Marsh, appreciating him being an opening band this morning for me. And then I'm going to talk about some of the work we do with a weight management program that's funded through West Virginia PEIA, the Public Employees Insurance Agency. You are welcome to stand. It's in the afternoon. If you want to get up, move around, we got a nice big room, and you've been sitting too long. I did tell my first session this. I teach class, right? So I've got a keen eye for people who are dozing off, okay? I'll kind of give you a little tap on the table maybe, if you're starting to doze off. In my job, just so you have a sense of what I do at the university, I teach in the sport and exercise psychology program. We have a PhD program. We have an undergraduate major that has over 400 students in it. I teach all the way from freshman level classes, general ed, all the way to PhD level seminar. Right now I'm teaching a senior level writing class, which is our capstone in the major, and I'm teaching a graduate introductory stats class. So that's kind of part of the other scope. I don't have a lab in CPAS. We actually do not have a lab. There's no lab facilities in CPAS. We only do work in the field. Okay, so all of our work is out in the communities, and so we are kind of an arm of the extension piece, and we do a ton of service to that. So I'm going to share some of that stuff. Before I get going, I want to send a note of thanks to the foundation staff for making this visit super easy. There's not a lot of my life where the travel is planned for me, and I just show up and try to do something, okay? So I appreciate these moments, and this is not my normal life, so I'm very appreciative of that. To all of my folks that I work with back in CPAS, we have a lot of people doing amazing work in the school system, in the communities. I'm just one. So on one sense, I'm of course very humbled to be here talking about that. And the other sense, I'm kind of I'm guilty because there's many people doing other amazing work, and I'm the one that gets up here to do that. My staff that works with the weight management program, that's what the WMP is up there. They're still back there. They were working on Thursday and Friday while I was down here hanging out in the sun. So they were doing the dirty work, and they continue to do that. So I just want to pass a note on to Maya and Kathy, Caitlin, Candace, and all my staff back at the weight management program. They do an amazing job, and they make some of this stuff happen, all right? So a lot of us are working on it. I want to give a little bit of my personal connection here. This is my family. This is my daughters on the bottom, 7 and 8. So this physical activity and health thing is very personal for me. I'm trying to raise my daughters to be healthy, so I'm dealing with this on every level, not just in professional. I'm going to share a ton of research and professional data, but I have a vested interest in West Virginia being a healthy place, being an amazing place for my daughters to grow up. This is my community, this is my street. You see one of the other faculty members from public health, Dr. Biltz up here, Dr. Holmes from Everly College. They all live on my street, and this is bike to school day. We did this 3 times. You basically have to organize organize a mafia to get your kids to school in West Virginia. It was a 2.5-mile bike ride. We crossed some roads, we went up some hills, we went on some trails, and we did this 3 times. To and from Mountain View Elementary School from South Park. When we showed up, the people who were like, the buses are coming in, they've got those guys out there and women flagging the buses. They showed up, we got 12 bikes coming in. They didn't know what to do with us. Had no idea, because clearly there were no kids biking to school or walking to school. But, we try to make a personal impact, like, hey, this is still happening, right? So a little bit about me. As you can sense, I'm a fairly enthusiastic guy about that. This is the bigger context. I'm not going to talk a ton about obesity today, but when I came across this is kind of a good way to look at it. There's so many things that are affecting what's happened to us, and it's kind of this in the middle, oversized lifestyle, right? So we have a lot of things that have happened, and I think Dr. Marsh pointed out 1960, change of guidelines, and it's really been since about 1985 where they started to measure obesity. And since we started measuring it, it's basically doubled from about 15 or 20% to about 35%. About a third of the country being obese, BMI of, and that's roughly more than 25 pounds overweight, for that. Some of the things that are combined to make this happen, it's not a simple equation. A lot of things have occurred. But the biggest things that have happened in that generation are environmental changes. So we have built so many restaurants, Starbucks, gas stations, places that you can consume a lot of calories. And where do they put them? Right where they're supposed to be. Because we're beautiful capitalists, we're the best at that as possible. So every McDonald's goes in the right place. Every Burger King goes in the right place. Every Starbucks convenience store goes in the right place, because we have people studying that and they know what the heck to do with it, right? And they know how to make that a profitable business. So though think about how many tens of thousands more businesses have opened in those 30 years, selling calories. Right? And a lot of times in West Virginia, we have a ton of places that don't sell great stuff, right? So people in the rural parts of the state, where do they get their food? Dollar General. That's the closest place. Otherwise, they got to drive 45 minutes or an hour to get to a Walmart. So they do local shopping at Dollar General, Big Lots. Those places have food now. If you ever try to shop for food there, guess what that food is? It's in a box, okay? It's in a box, all right? So, and you can buy a lot of it and get a lot of calories for not very much money. Companies are, of course, trying to make money, so they make food that's profitable. And unfortunately, that's often some of the least nutrient-dense, the worst food that we can possibly have. So it's a combination of these economic conditions with food, in addition to what have we done? Built more roads, more parking lots, more malls, more everything. So we're totally auto-driven. Compared to anywhere I've visited in the world, no place is more dependent on cars than us in the U.S. No way. And Morgantown is pretty bad in our respects to those of us who live in Morgantown. It's one of the worst places I've been in terms of walkability. Combination of this and lack of safe places to do that, okay? So what does it do? Well, I think we know enough about obesity that you probably know it's not good for you, but did you know it doesn't necessarily affects pretty much every single system? It depends a little bit, of course, the level of obesity that you have. Whether you're morbidly obese or not, and also where you're carrying that weight. There's been research with that. I'm not going to spend a lot of time on the medical complications, but as you can see, it's related to, at least, if not causative, to almost every single thing that people die from. Okay, and it's often comorbid with, particularly we lead the country, or we're second in diabetes, so that's the one that's really the most severe, in my opinion. I want to make this a little bit more personal, because sometimes when you talk about obesity, and these huge problems, so these are some folks who have entered into our program. I'm giving them pseudonyms. In terms of, here's West Virginians that struggle with this issue. You got one of the librarians at one of the universities, not at WVU, has just started to gain weight. She has a sedentary job, and it's starting to affect how she feels and her activities of daily living. So Gina started to struggle with that. Okay, what does she do? It's getting in her way. Jimmy's in worse health. I think you'll see later his BMI is about 45, which is pretty high. His doctor won't give him the kidney transplant he needs because he's not candidate for. He may not survive the surgery. So he's faced with, what am I supposed to do now? So he's encountering that. He's starting to feel bad. He's very worried about his health. Carol at the bottom, retired teacher, can't go around Walmart without the cart. She's embarrassed. She can't make it all the way around walking. That's the state of her physical health. Doesn't know what to do about it. Kathy, our staff dietitian, who's an amazing woman, originally from Pennsylvania but lives in Fairmont now, she gets pretty fired up about the health of the state of West Virginia. And you got to see this quote she came up with last week. West Virginia is almost heaven because we're almost dead. No, like when I heard this quote, I said, did you really make that quote up? Because that's amazing, right? So she's a fiery Italian woman, and when she gets upset, she gets upset. Now, I'll tell you later how she channels it in an effective way, but sometimes it's like her head comes off. You have some of those people that you work with, or just the top pops off of that. I'll tell you how these stories end later. Okay, so why focus on physical activity in terms of how can we make effect on this? Well, we got to see some of that this morning. But it has, the thing about physical activity compared to a drug or another form of treatment is it affects a lot of things. So physical activity will affect your cardiovascular system. It will affect, of course, your lungs. It's going to affect your blood sugar. It's going to affect your endocrine system. It's going to affect your brain. There are studies out there showing that kids who are fit do better on their standardized achievement tests, which is why it's so frustrating we can't get policy in place to make sure that universal physical education is there, but it's a side topic altogether. It also changes the brain at every single phase of life. So in working, one way I use physical activity is in the middle of the day. That's when I usually try to be physically active because my afternoons, I mean, I could sleep any day in the afternoon for sure. So if I take do some sort of physical activity around midday, then my afternoons go a heck of a lot better and I seem a lot smarter. I'm not sure if I actually get smarter, but at least I perceive that I am. That's the beauty of physical activity. We do know from some of the data more protective than your fatness in terms of predicting your mortality. The Cooper Institute down in Dallas that have compared obese fit adults to regular weight or normal weight unfit adults. And when they match them up, the obese fit adults actually have a lower risk of mortality than the unfit regular weight. Okay, so it does some comparisons there. Now, there is some exception to this rule in the sense that if you have morbid obesity or you're having an extreme amount of that, then it can counteract that, and weight loss is a predominant concern. But in general, fitness is a hugely protective factor. Another reason in terms of us in West Virginia investing in physical activity compared to, for example, maybe food policy changes, such as soda resistance or soda tax, is there's so much industry resistance to any sort of food-related change. Right? There's no one really pushing back of, hey, kids should be more active. Right? There's no industry standing up, waving and lobbying in the state Senate to make sure that doesn't happen, okay? But there are for any other change. If you want to change the snack machines in schools, well, here comes the Snack Manufacturers Association, right? So there's no industry resistance to that. And we don't want to forget that we are in a capitalistic climate that things have to function within the economic climate that it occurs. Now, I'm not a policymaker. I know hopefully Dylan will be, and he'll make some changes here eventually and do that. But strategies have to work within that. Can't be total idealists, but we do have to be completely motivated to make those changes. Let's look at some of this good data. You've maybe seen the obesity maps. These come out from CDC. This one's from 2014. Where we vary between 1 and 2. We get into pretty good fights with Mississippi about who's really in worse health. That I feel like they're a sister or brother state of ours, Mississippi, feeling our pain. What do we share with Mississippi? We share low education and socioeconomic problems. So we share social conditions that put us in those situations. They also have a bunch of rural parts of their state as well. So there's some of the reasons that we are like that. And another thing that people don't know about West Virginia is that we're one of the oldest states in the nation. It's kind of we're Florida in that way. I don't remember where we rank exactly. So in terms of our health, how much we depend on Medicare. Medicaid also influences our health care spending, which Dr. Marsh talked about. You've already seen some of the negative stats. Here's the other piece of the equation, which is the inactivity part. Okay, so there's two pieces of the physical activity thing now that's coming out of the literature. One is, are you doing enough for your health, moving, and then are you sitting too much? Two separate things. So this kind of idea of being fit, and we'll get to how much that is, 150 minutes of physical activity, but then are you also sitting too much? So the recent research has suggested that sometime during the early part of your day is the best time to initiate some sort of movement, because if you're sitting for more than 5 hours at the beginning of your day, your metabolism never recovers for the rest of the day. So even if you go exercise later, you don't get the benefits that you could get from that. So one good quick suggestion, do something before lunch that involves a 5 to 10 minute walk, or you stand for 30 minutes in a meeting, or you do something, as opposed to, here's what happens in most places in America. I get up, make my cup of coffee, I go sit in the car, I drive to my place of work, I get out, walk 100 yards, I go sit at my desk, and then lunch comes around. Okay, so then there goes 6 hours of me just no activity. And then what is your body? Because your body's pretty smart. It says, okay, you're not going to do any activity at all? I'm going to shut this thing down. Okay, I'm going to shut this mechanism down so that it just metabolism sinks. Now, you repeat that for 6 or 8 years, your metabolism is not going to be the same as it once was. So it's one of those kind of use it or lose it type of things. So in small bursts, we're learning that small things like standing count. Whereas it used to be in the 80s, you had to go do aerobics. You remember the socks and stuff like that, you had to go sweat, right? And that's not necessarily true anymore. There are benefits for that. However, we need to get a lot more people doing a little bit. The physical activity statistics from recent years are kind of confusing to read, but the most recent with accurate measurement is about 1 in 10 physical people in West Virginia meet guidelines for physical activity. Let me tell you why it's so poor, though. They changed the measurement. So we used to ask people, hey, how active were you, Amy, last week? Oh, 3 days. And, well, how many minutes did you do that? Okay, I did it for 30 minutes. So we used to ask self-report data. Hey, how active were you? And when we did that, the marker was about 45 or 50% of Americans are physically active. So then they said, oh, you know what? We got technology now. We're going to give you Fitbit. We're going to give you an accelerometer to track how active you are. And so the rates went down to somewhere between 5 and 10% when they started measuring people. So I can be reasonably accurate in telling you it's somewhere between 10 and 45% of people are meet the recommendation for physical activity, and it's all going to depend on the type of questions that you ask. One thing we do know, however, is that early deaths are on the rise to diet and physical activity. So we are seeing it's almost a 20% increase in the percentage of deaths from generation ago, 1990 to 2010 data, whereas we've made progress in smoking, right? We're starting to see a reduction in smoking deaths. Policies are starting to get in. There's been social change. That's a less socially acceptable behavior in the U.S. So we put the right policies in place, culture has changed, social changed, and it will take effect over generations. That will occur also with physical activity and food. It's just now starting to build that momentum. We're not there yet. We have a lot of progress to make. So, what do you need to do? I think you got a little bit of this today. One of my PhD students, Ashley, helped me put this together, so I got to give her some great credit. Her and Kate have been awesome in helping me put things together. This is the percent of your day that you need to commit to being physically active. So, the maximal you see over here, if you're active for an hour a day, 4% of your day. Okay, that's factoring in all 24 hours, right? 1 hour out of about 24. But have a look at the bang you can get for less than 1% of your day. So some of the data from the Nurses' Health Study, Harvard alumni study, suggests that if you compare the least active group, basically does nothing, to a group that gets about an hour a week, there's enormous benefits. And if you can see the list over here, you have a reduction in mortality by or risk by 45%. You might get 3 years. And depending on which study you look at, data this morning, the physical activity will get you somewhere between 3 and 8 years, okay, in terms of lifetime. Now, I got to tell you a funny story because I've had students in class and they like back with me, we have a good time, and they say, Dr. Zizzi, but if you spent all that time exercising and you end up living all that extra time, doesn't it just wash out? You know what I mean? The idea, like, when you have spent 5 years actually exercising, so then you're not getting it back, So I was like, that's a fair argument, I suppose. Kind of pessimistic, all right? But it doesn't necessarily factor in, of course, the quality of those lives that you're leading, right? And I'm pretty sure as you get older, and I have a mother who's 85, and her message would not be, she's not worried about making it to 100 if she doesn't feel right, okay? If she's starting to feel terrible, she's not worried about making it past 90. Fortunately, she feels fantastic, and she's leading the chair exercise at the senior center probably as we speak, okay? So she's the first physical activity advocate in the family. I'm second, okay? You can see as you get up a bit of diminishing returns. This is the general recommendations for 30 minutes a day, and you can see specifically a lot of the benefits that you're getting to your health. This can be, by the way, accumulated. You don't need to go out and do 30 minutes in a row. You can do 10-minute bouts. You can do 3 10-minute walks. You can add it up together. It can be household chores. You can be pushing the vacuum cleaner around. Okay, as long as you're sustaining that level of intensity for about 5 or 10 minutes at a time, you can add those things up. In general, what do you need to do? You get a reduction in mortality about 1/3 by doing 30 minutes a day. Okay, so you have to think about whether your reduction in risk of death is worth that commitment of 30 minutes a day, right? There's a great cartoon that sometimes show in class that has a guy going into a doctor's office, and he's sitting there and he's got this kind of big old belly. And he's kind of looking sad because the doctor's about ready to give him some results, right? And the doctor says, well, what's better? 30 minutes exercising 30 minutes a day, or being dead every minute of the day? So he kind of gives him that kind of mortality kind of tune. Hey, what do you think? Which one do you want? Which one do you want, right? Pay me now, pay me later. However, if you do some, but not more than 30 minutes, you still get a great reduction. So, can we really go? Can we take the state of West Virginia and move it forward? I think it's possible we can. Can we go to first? No, I don't believe we can go to first. Like, I'm not a pessimist in that way. I'm quite an optimist. We're working on it. There's tons of people working on it. Now, can we have the most innovative educational policies? Yes. We have the most progressive, safe streets campaigns? Yes, we do that. We could lead the country in that. Could we have one of the most innovative insurance-funded programs? Yes, we're doing that right now, and I'm going to show you some of the data on that. So everyone would have to be engaged for that to occur. But the economic conditions of West Virginia and the demographic profile are not going to look like Colorado and California no matter what we do. I don't think we're going to export everybody who's living there and then bring in other people, right? So we have to work within the current conditions, and we can have successes. And I know Dino Beckett, the doctor that was featured this morning in Dr. Marsh's talk, and he's doing amazing work in one town. It can happen. That's the beauty of West Virginia is it only takes a couple people in those towns to turn them around, right? And you could combine the economic turnaround with the health turnaround as well, right? And linking those together, they go hand in hand, and it would have to, because in a lot of those towns, without economic development, there's no point of health development, right? Because people aren't going to want to live there. There's no families, no schools, nothing, right? You've got to have the two work together. So what do we do with all these folks now that are adults or in West Virginia, they've been living there, they're unhealthy? Well, I want to tell you a little bit about this program that I've been working with. So for the last 10 years or so, I've been involved with a weight management program that's funded by the Public Employees Insurance Agency of West Virginia. It's a big old thing. Weight management program is what I'm going to term that. It is probably one of the best deals in healthcare that you can get. So just have a look at what you get. So for $20 a month, which is the co-payment. Now I know if I go to urgent care because I need to get like something, my daughter has pink eye, that's going to cost me $25 at least, just right there. Just to show up and see a doctor costs me $25, okay? So for $20 a month, they get their gym membership, which is in their community. You'll see some of the locations here. So that's first of all, that's a good deal in most places in West Virginia. Then, if they stay consistent, they go up to 2 times a week. They can stay in that program for 2 years. During that time, they will get 4 fitness assessments, 1 month, 3 months, 6 month, 13 month. They'll have 4 sessions with a dietitian to personalize their nutritional program. They get 26 hours of personal training, including 2 every month in the first 6 months, so they can get going. Some facilities do that kind of 30 minutes a week. Some do it twice a month. They get an opportunity to learn the skills they need to learn to change their lifestyle. So it's a lifestyle change program. It's not a weight loss program. That's why it's called weight management. And it provides them with the professional services so that they can figure it out, not being on their own, and the support. These facilities are in their communities. You'll see in a minute how many we have. They're all over the state of West Virginia. They're typically physical therapy clinics, fitness centers, YMCAs, other community-based gyms, okay? So in general, they get about $1,600 of professional services delivered. They pay $500, plus they get the gym membership in a 2-year period of time. So basically it's a 20-80 split between the cardholder and the insurance agency. So it's a similar kind of model as some of the other services. The innovative thing about this program that there aren't a lot of otherwise in the U.S. is basically the fitness centers are service providers and are billing the insurance agency. So 60 minutes of personal training, yep, I did 60 minutes with Gina, and at the end of that period of time it goes off, gets billed, and they get actually paid for that service. So it's a professional fee-for-service model that's now in the fitness industry as opposed to, at your medical clinic, which is how they work, or a physical therapy clinic, right? So it's taken that model, applied it to fitness centers, and now we've had some bumps in the road, and some places do it better than others, but it's going fairly well. In terms of weight loss, which is one of the big outcomes of the program, after about 6 months, we have about 44% achieve a clinically significant weight loss, which is considered more than 5% of the weight, your starting weight. In general, somewhere between a 5 and 7% weight loss has incredible benefits to people's health, regardless of how heavy you are. So if people start at 300 or 250, even losing 5 to 10% of weight, which is not a huge amount for someone like that, they can see substantial reductions in cardiovascular risk and a variety of other markers just from that amount, in addition, of course, increasing in fitness. By comparison, the gold standard trials of weight management, such as the Diabetes Prevention Program, Look Ahead trial, there's been a number of other randomized trials that have been funded by the federal government. Generally, those folks are losing between around 7%. Okay, so these are funded trials in centers, highly controlled. We have these folks out in the communities by a bunch of different kinds of staff, and we're getting reasonably comparable results at a much lower rate in my opinion. So we started in 2005. I will say this program was initiated by the PEIA Health Promotion staff. So Nydia Henderson is the Director of Health Promotion there. She has a bunch of people that work with her, Amber and Felice, Mike Bros. The CEO right now is Ted Cheatham. He's been super supportive of the program. So this initiated out of them, and in 2008 we got a contract in CPAS to evaluate that program, to understand what are the best practices, how can we make this the most efficient program as possible. And so we've been involved one way or another from 2008. In 2010, we took over the operation of the whole program, and we now administer it, evaluate it, and provide some of the services in the program out of our new health and education building on the Evansdale campus. So here we are in 2016. We have about 70 locations in 30 counties, and we currently serve over 1,000 people at any given time. So in a normal month, it's an ongoing program. It never stops, never finishes, right? So you want to start in Beckley, you call us on the 1-800 number and you say, hey, I want to go to BodyWorks in Beckley. So you fill out a bunch of paperwork, you send it in to us, we refer you over to BodyWorks, so you go get your services at BodyWorks in Beckley. We track you. If we need to kick you out because you're not going, we kick you out. Okay, so we hold you accountable. That's part of our job. In the communities where the PEIA members are, they have the services there. The only exception to that would be we have a dietitian, Kathy, that might provide phone counseling to you if you don't have access to a dietitian wherever you live. We also have 2 behavioral counselors, Stephanie and Kelly, that work to help you kind of put all the pieces together, right? So most of the stuff is happening in the community. That's where people are going, and you can see we've got it in a lot of places. So the term I'm using here is we have this fitness infrastructure now in West Virginia because of this program, where in Beckley, in Charleston, in Martinsburg, we know where there are people who know how to work with folks who are very unhealthy. We have BMI average in our program about 33. So the average person in our program is obese. That would be about 35 pounds overweight on average. And we have folks BMI up to 72 in our program. So we have some incredibly ill and obese folks in our program, and we have folks now that know how to train them and know how to work with them, because that's different than a regular gym client, right? That's very different than someone just walking in, hey, I'm going to go to Weight Watchers, I need to lose a few pounds. No, these are folks who need the whole thing overhauled. They need everything, every part of the lifestyle overhaul, all right? So we got a lot of stuff happening there. I was lucky enough last fall to go visit 40 of the facilities. I did a sabbatical and went around and interviewed the staff, interviewed the dietitians, people who are there working out, to try to understand how is this program working, who's doing it better than others, why is it really working well down there. We had one facility where they were losing 18 pounds on average in 6 months, which is an incredible outcome, because average in the program is something in 6 months would be something like 5 pounds, right? Average. Generally, people lose about 1 pound a month. It's pretty slow weight loss progress, but these folks were losing 18. So I'm thinking, well, what are they doing down there, right? Tiny little gym down in Sophia, West Virginia, which is about 10 miles down a crooked road from Beckley. And I go out to this place called A Place to Heal. It's a little physical therapy clinic. And they basically are screening people from the beginning. So, they get a referral, they call Jimmy. Hey, Jimmy, listen, if you come in here, we're going to be on you from the first day you're in here. I just want to let you know this is not a free gym membership, okay? And if you come in here, we're going to be on you every day. And if you're not here, I'm going to call you and find out why you didn't come in. So if you tell me, so they're holding these folks to this tough love level of accountability, and they're seeing dramatic results. Because they're willing to go the extra mile and make it like a family type of atmosphere, and create it. And they have a kind of a small place there as well. So they're doing an exceptional job. Now, a funny story, because we got a little bit of time. Has anyone ever been to Hollywood, West Virginia? So there is a Hollywood, West Virginia, and if anyone's been there, I'll be really impressed, because I couldn't get there. I tried. Okay, so you go down Lewisburg, you hang south down 219, and you head into God's country. All right, down near Alderson. All right, you got to turn left off at 219, like you're going to go to Virginia Beach, but you're not getting anywhere near there, right? And you head towards Hollywood, and you need to take a couple more turns according to my GPS. And then when I was going up a gravel driveway that looked like somebody's house, and it told me I arrived in Hollywood, I turned back around, went to 219. So I never made it to Hollywood, West Virginia, so it could be a myth. I'm not sure. But you can find some interesting things around West Virginia. So, the good news about CPAS and the work that we're doing, I think one of the things I love about it is, I'm not stuck in my office. As I mentioned before, I don't have a lab. We don't do lab research in CPAS. We don't have labs. There aren't labs in our building. So our lab is the field. Okay, so very important for me to go out and understand what's happening in the community. So I have this kind of local contextual knowledge combined with the fact that I've been lucky enough to go and present this stuff in these countries. So I've been lucky in my job since I started working at WVU. This is where I've been. Okay, not only just to talk about physical activity, this stuff, in some cases it has been. So I have a very good sense of where policies are different, where environments are very different, where are we making mistakes. So in terms of, I have a great luxury now that I can return to my students, back to my research, to be able to take some of these lessons I've seen in Asia and other places in Europe, to be able to go, okay, well, why are we doing this? Because when I grew up in West Virginia, I had no clue. Right? I mean, I had no idea that no one knew what a pepperoni roll was, right? Okay, so I went over the state line to go to Virginia. I went to James Madison, and folks were like, what's a pepperoni roll? I'm like, what are you talking about? The state line's right there, like 15 miles away. You don't know what a pepperoni roll is? So that's a small thing, but right, you see something in a different way when you travel. And I was so excited to hear the students talk about their international experiences and passion for that. That's just awesome. And by the way, I'm one of the faculty leading the new Adventure South Africa trip coming up in July. So if you want to kind of hook that up later on, we can talk about that, okay? So just a little combination of that. So this program is starting to gain some recognition outside of West Virginia. These are some examples of stuff that we've published. I want to make a couple points on this particular slide. We were featured in a book in the middle that was published by the Johns Hopkins Press about innovative approaches to the treatment of obesity. So we're among about another 30 or 40 programs in the U.S. that were featured. Actually, there was some international stuff in there. We published in all kinds of journals, and getting back to the students for a minute, a lot of these folks on this project were students with me on those projects. In this case, most of these are graduate students. However, I have also published with undergraduates as well. So this research process, this practice process, we're trying to turn this data, in the field of medicine and psychology, everything is about evidence-based practice, right? All this evidence-based practice. Where's that evidence coming from? Mostly trials, to be honest. Mostly trials in labs. The work we're doing is on the opposite end of the spectrum, practice-based evidence. Like, okay, let's see what happens when you dump a program into a community and you say go. Right, and we're evaluating that. So we're trying to put the two pieces together to understand, this idea of translating the how do you change behavior, how do you help people change? Well, we can't totally understand about doing it in a perfect lab situation where everyone comes in and gets their measurements and they're incentivized to come in and get a lab. And on the other end, we also can't not implement some of those guidelines into the practice, into the communities. We have to know what we're doing. We can't just let it be total chaos like a circus. So it's that balance of internal and external control in the research. And so we're able to kind of get that out there and get that published, which is awesome. We also have a weight loss blog and a resource page that we have for people in the program, and it's visited by thousands of people per year who are trying to figure out how to change their lifestyle. So the theme of the blog is really about how do you change? How do you go and make those changes? How do you make it stick? Right? Because you can get on the internet and find a workout routine anytime you want. Good luck if you want to search for a diet plan. You ought to try that sometime, right? You want to lose your mind trying to figure that out. Say, hey, I need a healthy diet. Oh, you're dead now, right? You're dead. You're dead on the internet. There's good things that the internet's good for. This would not be one of those. You can certainly find a recipe for anything you want, which is a fantastic thing. In terms of how to make it stick, no, that's kind of our expertise. That's our expertise. So some outcomes we see in our program. Physical activity is one of the biggest, and you have a look after 18 months in the program. We have about 3 and 4 meeting the physical activity guidelines who are participating in our program. So we're going, at the beginning, roughly 10 up to about 75%. One of the reasons it's so high is part of the physical activity guidelines now require you to do some sort of muscle strengthening exercise, like lifting weights or yoga or some other sort of calisthenics on your own, push-ups, sit-ups. And our program is big in that because it's at a facility and they're getting those skills. They're being taught how to do all those things. Generally, the best sites are not only showing them how to do the circuit in the gym, but they're also giving them a home program as well, right? Because there's no way we're going to fix the obesity crisis by building more gyms. How many more gyms do you think have been built in the last 30 years, right? Probably not as many McDonald's, but a lot, right? A lot. So it's not just the gym, it's the skills learned in the gym, and then eventually people go, I'm sick of going to the gym, or I moved, or whatever else, and they got to do it on their own anyway, right? So as an example, when I was a college student, it made a lot of sense to go to the gym. There it was. I was on the campus, right? There it was. I got access to it. But now as a father, right, going to the gym is just time away from something, either time away from my work, time away from my kids. And so unless I can get my kids to the gym with me, and we do use the student rec center quite a bit to swim, and rock climb and do that kind of stuff. Unless I'm going to do it with them, it's out of the way, right? So it changes. So the gym is not the only answer. It's the lab that they learn what they need to learn about how to eat well, how to be physically active, what things they like to do. And so we're seeing some great success with that. There's some cool stats that my kind of the boss down at the weight management put together. Overall, we've hit 15,000 people with this program. So it's had a huge footprint in the state. PEIA insures something around 200,000 people when you factor in how many people hold the policies and their dependents. So we've hit quite a bit of that. We still have a lot more to do it. You can do it a second attempt. So if you fail out of it and you screwed it up, after a year they'll give you another shot at it. You can go back and give it another attempt, which is cool because most people do fail. Smoking, as an example, there's research out there that suggests you need 7 to 8 attempts. So all those failed attempts are actually just part of the path of success. It just depends on how you look at that. So if you are kind of having that experience or you have friends that have had that experience, sometimes you need to fall 6 or 8 times to try to figure this out, and that's just part of you figuring out what it is that you want to do or how it's going to work, okay? We have over 300 service providers, meaning registered dietitians, physical therapists, personal trainers, and exercise physiologists. So this is PEIA, West Virginia, right? State taxpayer money going back into the state, paying these folks for services they're providing. So it's a really sustainable model of, here's my tax money, paying to help reduce the premiums of West Virginia citizens, and we're paying West Virginia people to actually do the work to help them do that. So it's a reasonably sustainable model, and obviously if it's been going for 10 years, the insurance agency is seeing value in that return on their investment in terms of it staying around. Another big benefit that our participants see is reduction in medication usage. So if you look at the red bars here, for both diabetes and sleep disorders, such as sleep apnea, we see a reduction in about a third of people who start the program with one of those medications either drop a medication or reduce the dosage after 6 months of participation. So that's one of our kind of main outcome barriers. For the other issues, we see about a 20 to 25% reduction in medication usage there after 6 months. And those do sustain, so people might drop a second one. The amount of medication people are on when they start a program is just mind-blowing to me. It is unbelievable. We have about a third of people medicated for anxiety or depression when they begin. A third. 1 in 3 are on anxiety or depression medications. Okay? I mean, it's extraordinary, the amount. And the amount who are on like high blood pressure, as you can guess, high cholesterol medications is a lot. Okay, so there's a lot of our participants who have more than one medication when they begin. And they're basically kind of worried well people. In other words, they're fine. It hasn't affected their work yet. It hasn't affected their ability to be a mom or a dad yet. But they're on the path of disaster, basically. And if they can figure out how to change their course, it can have a huge impact on the subsequent years of their life. So it's not just that quantity part, it's really the direction that they're going. One other thing that links to something Dr. Marsh said this morning was healthcare spending. So we asked people at the beginning of our program, are you thinking about getting bariatric surgery, which is stomach staple or laparoscopically, you can reduce the size. Now, this is a radical intervention, folks. If you get the stomach staple, it's not reversible. They literally staple and make your stomach smaller so you can't eat as much. The laparoscopic procedure, they put a little band around it and make it smaller, so you have to eat little pea-size amounts, like this amount at a time, right? Huge, huge modification to your lifestyle, right? So, and as you could guess, it's not cheap. So on average, costs about 8 to 10 grand per surgery to the agency. So we estimate we've averted about 300 based on the feedback from our participants, saving the insurance agency and therefore the state of West Virginia about $2.5 million. So let's have a look and see what happened to our participants here. All right, we got Gina. She ended up losing 90 pounds. She's now running 5Ks. Got rid of the junk food in her house. And has made a turnaround. That's her up there. This is obviously a fake name. She did share this with us, though. She's looking a heck of a lot better, right? Jimmy made it through. He didn't die. He got his new kidney, all right? So he lost a ton of weight, got down. He's still an obese guy. He's still in his 30s in his BMI, but he got down to a point where he could have surgery. It was successful. It just happened a couple months ago. Now he's back, and as soon as he gets cleared, he's going to start and do his second attempt with weight management. Kathy is channeling her frustrations. She's working with clients. She's in the legislature making sure that this tobacco tax passes. Please, God, let us pass this tobacco tax of $1. It's in the legislature right now. Hopefully we can do that. And Carol is now at the gym 4 days a week and has lost a bunch of pounds and she can get around and shop on her own. So these are quality of life effects that are occurring now, and if they can sustain these things, it will be massive changes as well. So when we ask people, what do they say about the program? What do they have? What are their feedback? The bigger words are mentioned more. They feel differently. They're having a huge relationship with their personal trainer. Okay, and you can see some all of us statement here. They're feeling great, helpful. They really like it. They're having a lot of positive things to say, about the program. And I know I need to wrap up. We're getting there. So I guess the question I have for the audience, and I put it to the last group too, is, WVU is leading, is already doing innovative things. This is just one example. Many of my colleagues are doing many amazing things as well. And so for the people who are here in the audience or on the committee, I want to know, how can you now help us go to the next level? How can we take this particular model of incentivized insurance stuff to other states, to other employers? How can we take that WVU brand to other places? So if you want to talk to me about that sometime later at dinner tonight, I would be happy to do so. So otherwise, if we have time for questions, let's do that. Thank you so much. We got probably time for 5 minutes. 5 minutes, sorry. 5 minutes. All right. Anybody? Yes, ma'am, Amy, what's up?
I'm curious. I work at the College of Education and Human Services, and we have a garden-based learning project that's focused on bringing garden education into the schools so students are learning about it. So I guess I'm curious, maybe not you yourself, but who at your college is taking it into schools, because I feel like if you start in the schools, hopefully you don't have that 50-year-old, 45 BMI adult.
It's true. I mean, we got to do both prongs, right? Because we got all these people out there now who are kind of one of the unhealthiest generations ever. The ones we're working with now are estimated to not live as long as their parents, which is the first time in history. So the population right now is in rough shape. So we have in our program physical education teaching, and there's folks working down in the southern part of the states trying to change the entire school system so that activities are in the right place, continuing education for teachers, not necessarily with gardens so much, not in our area, but comprehensive physical activity programs. Well, I think the biggest thing that needs to happen in the school system is joint use agreements for the facilities. So our schools are some of the best facilities recreation-wise, but they're locked up after 3 p.m. and there's all this liability nonsense about we don't want to let the public in. But those are huge resources. Like in certain counties, that's the best place to be active. Safest, flattest, nicest facility, whether it's a track, ball field, whatever. We have to get kind of universal joint use, reduction of liabilities. We have to be able to use our lawyers, our policies, and make sure that we can share those, because those are state facilities. Like I feel like I own those facilities. Why can't I go to the school and use that, right? We have to be able to figure out a way to do that. It gets around the whole, this is legal. What if somebody gets hurt? Does the state of West Virginia get sued? So we got to be able to do them both. My passion right now is adults, and I have other colleagues that are doing the kids stuff, too. So maybe just one more. Yes, ma'am. Well, certainly I have some colleagues working on that. I know John spoke at that this morning, John Saldana, talking about how do you distribute the food in the right places. There are a lot of innovative programs where kids are doing gardens, and there are dietitians out in the state educating people about how to shop at Big Lots and Dollar General, and how do you buy canned food and create healthy, nutritious places out of that. So the extension agents are definitely doing it. I don't have the answer to the food deserts in West Virginia. Down in Williamson and that area, they're using mobile markets. They're taking the stuff, they're putting it on a big bus, and they're taking it around so people can get it. They're taking it to the people as opposed to waiting for people to come and get it. So probably there has to be, and they do that with breast cancer screening as well. They take Bonnie's bus around, and that's how they get screened. So we need a solution that's like that allows them to do that for food. It brings it to them. And, I think with the business department, I think the system of connecting the supply chain and making that economically viable is happening. Because I know in Morgantown area, it's expanded tremendously. We have CSAs now, cooperative agreements with farms that are coming into town, not just markets. You can get it delivered to your house now. So I hope that will happen in other communities too. So not necessarily my expertise area, but. All right, well, I think we have to wrap things up. I appreciate everybody's attention, and have a good afternoon.